Hello, hello, friends. Happy Wednesday, wherever you are, wherever you're joining us from. We're thrilled you chose to spend a couple of minutes with us. We'll give it just a minute or two. I see everyone's jumping on. We got quite a few folks today. Awesome to see y'all. Thanks for jumping on. Thanks for spending the time. We'll give it just another maybe 30 seconds, and then we will get rolling. We have a good session for you today. If you can hear me, I'll fire up the chat in Zoom. If you can hear me and see our first slide, go ahead and drop something in the chat. Just say, "Yep, can hear you, Dave," if you can. That'd be super helpful. Amazing. Thank you all, friends. Good afternoon, Gwen. Good afternoon. Good to see y'all. Okay, friends, let's go ahead and get rolling. Thanks for the quick audio visual check. Friends, we have a really cool session for you planned today. If this is your first webinar with Provider Trust, welcome. We're thrilled you're here. We're thrilled you're joining us. If you're an old veteran and you've been to quite a few, we're thrilled you chose to come. We're thrilled you continue to choose to come back. We are taking a first. It's the end of July. Today's session is connecting HR and compliance to keep patients safe with really just what can you do in the back half of this year, given all the things happening in the world, to really bring together HR and compliance. If you have, whether this is your first or your 40th webinar with Provider Trust, we talk frequently about connecting HR and compliance to create a safer environment for patients and a safer environment in your organization. It's something that we believe deeply. We continue to see it play out, and certainly of all times now is so critical. Even as the news headlines roll in day after day, we are talking about compliance and HR on a daily basis and how those two can work together. Couple of housekeeping things. For sure, we would love for this to be interactive. So if you've got questions or you've got feedback or anything along the way, just drop it in the chat. I keep an eye on it throughout. And so if you've got a question, certainly happy to answer it live. There's no reason you have to wait till the end. Right? If you've got a question, just type it in. We'll answer it as we go. Our speakers today, certainly there's myself, but as always, we pull in our Chief Compliance Officer, Donna. Donna is just an industry. She's just the industry gold standard of compliance, and certainly with this topic, connecting HR and compliance, she does us such a favor in joining on these webinars on a monthly basis, and certainly you'll hear mostly from her today. You will get a copy of the recording of today's presentation and a copy of the slides. As always, this is also good for CEUs, so the CEU certificate will come shortly following the webinar today. Just be on the lookout from an email from Provider Trust. It'll have all the things in it. With that, let's go ahead and get rolling. We'll get into it. Made with Love in Nashville. Again, just a quick intro about who we are, and then we'll get into the session itself. We are Provider Trust. We're a healthcare data and technology company. We are based in Nashville, Tennessee. We consider ourselves to be really a thought partner as it relates to compliance strategy in healthcare. We do ongoing compliance monitoring for health systems, for post-acute systems, for payers, sort of anywhere in between as well. And because of that, we sit uniquely as being a strategic partner to so many of healthcare's finest brands, as well as we are so well versed on the trends in the industry, even as tactically as what's happening at the primary source. And so we'd like to combine the work that we do and deliver information for free that's really helpful to just the leaders in the industry, so y'all can take it and do something with it. It's a little bit about us. You'll see if you go to providertrust.com, you'll see this tagline. This is what we believe deeply. Our monthly webinar cadence is simply an extension of what our brand promise is, which is we believe deeply that a smarter healthcare makes a safer healthcare. And that means we do everything from healthcare license verifications at the primary source to OIG exclusion checks to total enterprise compliance and eligibility monitoring. We deliver it all in one powerful platforms that really at the heart of it is to create a safer healthcare for patients. Today's agenda, that's enough about us. Today's agenda and the things that we'll cover as we look towards the back half of the year and connecting HR and compliance. We're going to kick off with just what does this partnership look like at a 40,000 foot level? How is it evolving? Certainly we are well aware that this webinar is really timely to be happening during a week we have seen all sorts of major brands across healthcare start to mandate vaccinations for employees, and really connecting HR and compliance from our perspective is at the heart of so much of what we are reading about and hearing about and learning about as we all continue to react to COVID-19 and to keep everybody safe. We'll talk a little bit about the importance of trust, collaboration, and communication with specific examples and what does that look like and what does best in class look like. 3, we'll touch on in section 1 the 7 elements of an effective compliance program. We like to modify that at Provider Trust and say it's the 7 elements of an HR and compliance program. If you look at the intersection of the two together, but we'll go through specific examples of what might make you really successful, especially along the topics that we just mentioned as we kicked off in the back half of this year. And then solidifying the partnership. Our goal in these sessions, they're quick, and they're fast, but we like to certainly leave you with something that you can grab and say, here is something that I can do tomorrow if I wanted to. That's the goal of our webinars, is to make them certainly educational, but also impactful and with an actionable step at the end. So with that, I will kick us off as we start. We kick off the conversation around partnering to ensure compliance in today's world. So really where we'll start today is it's a natural partnership, HR and compliance. You may have seen this slide in a webinar before. We didn't just create this for this webinar. This is one we use all the time because it goes back to what we believe pretty deeply, which is the natural HR and compliance partnership that continues to evolve and continues to grow closer together. Most people issues require HR and compliance expertise. Both involve people and affect people, right? Involve and affect. And so we advocate that getting on the same page early and making sure there's consistency when you have those two things at top of mind is certainly critical. And both departments are accountable for ensuring patient safety. If you followed any of our prior webinars or content, you may have noticed even some of the brands that we've been speaking with. You know, one of our client brands, who's a major health system in the Southeast. We even, along the lines of accountability, we are noticing a trend where compliance and HR are actually sometimes even reporting to each other, right? So there may be structural accountability, not just individual departmental accountability, but structural accountability. If you've got a question on that, we have real life examples of a chief human resource officer and taking compliance under as part of a structural reorganization, and really the benefits and so many things that we've seen on the positive side of that change. And so when we say accountability, certainly we mean departmental and the objectives that compliance and HR have separately, but we're also seeing a shift in the industry in which some of that accountability may be structural and some of it may be shared. And as we go on here, I'll quickly mention, I talked through this, and I'd certainly invite Donna to jump in at this point too, but the 7 elements of an effective compliance program. If you're on the phone and you work in compliance, you've likely heard of these. You likely deal with all of these, even if you've never heard of it referred to as the 7 elements of an effective compliance program. And so we see this all the time. We are big partners and participants in HCCA's conferences and education, and it's something that's referred to in the industry consistently and often. And so when we think through the spectrum, Don and I were reflecting of, we have been in business at Provider Trust for about 11 years. And for about 11 years, we've thought through these 7 through a compliance lens. And as the world continues to change, we are starting at Provider Trust to think through these 7 through an HR lens as well, and to understand within these, there are compliance elements, there are HR elements, and there are so many shared accountabilities along the way, right? Enforcement and discipline, education and training, monitoring and auditing, response and prevention, policies and procedures, reporting, right? Within each of these elements, there are pieces that HR is starting to become a more active player in. It's not just compliance managing it all the way through. I think an easy one to grab, we'll mention monitoring and auditing later on in this presentation, but an easy one to grab onto is certainly education and training, right? Compliance may come up with the things that we need to train on. Sometimes and often it may be HR facilitating the training as part of our learning and development programs across an organization. So we certainly see so much of that just being a shared accountability across healthcare. Donna, we were going to ask a question here. I'm not sure if you dropped it in, and if not, I will go ahead. Let's see.
I just asked folks to say hi if they're part
of I got like 50 chats that were all just hi. Hello, everyone. We're going to drop a question in the chat, which is of these 7, which one of these elements is actually the biggest focus for your organization in the back half of 2021? So Donna, while I type that question, anything else, just the color you want to add to these 7 elements? I know this is a big one for you.
Yeah, thanks, Dave. And good afternoon, everybody. It's so fun watching the chat, seeing so many familiar names and some of you who said hello. It's nice to see you. I wish I could actually see all of you in person, not just looking at Dave every day. But I think the 7 elements, the reason that we put this slide in here again is, as a compliance professional, right, we kind of use those as the cornerstones, if you will, and really trying to derive effectiveness in some fashion. But I think it also gives us a framework of finding collaboration between our 2 teams, right? Between HR and compliance. If we can say, hey, we both really care about these issues, and these are some explicit examples of ways that we can work together, I think it just helps build that framework without even having to try hard to think about what an agenda would look like as your 2 teams work together, or where can we help prioritize the items. We can use this as the framework and get us halfway there in starting a conversation. So I just love this just as an easy reminder that, gosh, we're closer aligned than maybe we even realized.
Helpful. And Donna, why don't you take this?
Absolutely. So now let's talk about, we understand that there are components that bring us together, but how do we make that successful? How do we make that work? And certainly, in my humble opinion, it's trust, collaboration, and communication. So if we want to go to the next slide, let's just talk a little bit about why or what. We talked at the very beginning of the importance of patient safety, or really making sure that our patients trust us as much as we trust each other. And I think when, Dave and I talked, and when I do training at Provider Trust, or when I used to do training in my previous life, even at the corporate level, when I was training folks, I would always talk about how we may not touch a patient on any given day. At any point in time, we may not think that we're actually impacting our patients, but yet what we do and the way we make decisions, the way we support our staff, and the way we make sure that the right people are caring for our patients, we are absolutely impacting patient care and patient outcomes every single day. So I think always reminding ourselves that even if we kind of live at that corporate level, and we don't, and especially in today's environment, we maybe don't have as many opportunities to be in the provider space, at the hospital, at the nursing home, at the caregiver level, we do have the ability to impact our patient outcomes, and we should use that as our driver. So clearly, patient safety, patient outcomes are always our number 1 priority. Certainly from compliance perspective, right? We think about fraud, waste, and abuse, but all of that, drives down to patient outcomes. So how do we align between our 2 teams? On the right side, you see a quote from Dylan. Dave was referring to some of our great partners. Ochsner is certainly one of them. Dylan is, a team favorite, if you will. Dylan and I have co-presented on a variety of occasions. Love, love, love Dylan. And her quote was, if we want our patients to trust us, we have to be willing to trust each other. And I think that is absolutely crucial as we think about the relationship between HR and compliance. So first and foremost, give yourself an opportunity to get to know each other on a personal level. At Provider Trust, we have kind of a meeting structure. And the first component of our meeting is what we call a segue. It's just a question. It's just something to get people talking. And it doesn't have to be business oriented. It can be personally oriented. And I think that just really helps allow you to trust or get to know people better when you understand them at a personal level. Certainly always assume positive intent, right? We all have bad days. We're frustrated. In compliance and HR, we are oftentimes dealing with very, very difficult situations. Tensions can be high. We might not always pick the best words at the most appropriate time, and we may say something that comes off a tish curt, but always assume best intent, right? We know that our goal is positive outcomes. And then ensuring kind of establishing those boundaries, right? What are your responsibilities versus my responsibilities? Where do we clearly overlap, but ultimately where are my accountabilities or my responsibilities, so that we're not kind of left in that gray area. And then, if there does happen to be a situation where we're not on the same page, let's just make sure that we're openly talking about those things, right? Let's just make sure that we're not leaving things ambiguous. So let's just talk a little bit more on the next slide about how to build that culture of compliance within collaboration within HR and compliance, right? First of all, we know that we always are driving to the same message of doing the right thing, right? We want to encourage our people to do the right thing, make the right decisions, put patients first, right? We know we want to drive to doing the right thing. We want a culture that's consistent and fair, right? We talk about how to prevent whistleblowers on the compliance side, right? Always making sure that we understand if we have disgruntled employees in our organization, that they're staying within the organization and that they feel comfortable bringing those concerns to HR or to compliance, right? We don't want them leaving the organization or feeling a need to call the Office of Inspector General or the state survey agency or whatever it might be, right? We want to be fair and consistent such that our employees trust us to come to us with concerns. We should be familiar faces. That's really hard right now in this environment where many of us have been sitting, in a home office, not walking the floors of your particular hospital or healthcare setting, right? One of the things that we've talked about is turning your camera on. I cannot tell you what a difference it makes when I have the opportunity to work with our clients or when I'm working with the sales team and getting to know people, seeing people's faces, it matters. So if you're still having remote experiences and you're doing compliance committee or whatever other meetings that you're having, encourage people, motivate people to turn their cameras on so that you can be familiar and you cannot just be a voice or a name on a piece of paper. Certainly when we talk about, publications or documents that are routinely distributed across our organizations, the employee handbook and the code of conduct are two that every employee gets right when they come in the front door of our organizations. We look at them on at least an annual basis. Certainly a huge amount of collaboration between HR and compliance in building those two documents, making sure that they are properly aligned. And I think that's a great way to make sure that your messaging is spot on and together. And then certainly one message, right? Does it really matter if it came from me, the chief compliance officer, or you, the vice president and chief, human resources officer? It really doesn't, right? It just matters that people are hearing from us in a joint fashion, that we're all aligned, that we're working together, that we're responding to concerns, and really just showing that collaboration is what matters at the end of the day to make sure that our patients' needs are met and that our employee needs are met. So communication practices for joint success, right? What can we do all the time? Routine communication. Where can we gather some of that ongoing feedback, right? We just talked about consistency. So consistency amongst everyone in the organization, but making sure that we're asking for feedback from our partners. So as the compliance team, I'm asking HR, hey, are we communicating effectively? Are you hearing good things about what we're doing? Are things that we're producing clear and concise? Really making sure that you're asking for that feedback on a consistent and routine basis. And then, gosh, we're going to not always agree, right? There are always going to be things that pop up that there might just be a bit of conflict around that needs somebody, else's insight. Do it together. Do it as a partner, right? Come together and say, we both are on opposite ends of the spectrum. We can't seem to find a happy middle ground. Please help us and bring it together. I think that's really important. Sometimes really hard to do, but I think it will really help establish that constant and consistent collaboration between the two. And then really just routinely, right? Let's make a point of saying, we're going to meet on a monthly basis, or we're going to share this information on a weekly basis. I might want to share all my hotline calls with you on a weekly basis, just a roll-up report. You might want to, from the HR perspective, there might be metrics related to the volume of new hires, or the volume of turnover. That's really important for compliance to see. So think about what those weekly maybe reports or communication might look like, and then put those meetings on your calendar. It will really help.
And so before I'm going to jump in real fast and let Donna take a breath, we wanted to anchor back to a specific part of the 7 elements of an effective compliance program, or the 7 elements of an effective HR and compliance program, and really just give this specifics of joint oversight and how this can actually work with something tangible and grabbable. And so as we talk monitoring employees together, that's the lens in mind. And then I'll pass it back to Donna.
Thanks, Dave. I'm just looking at the chat. So there's a variety of things that folks have posted. So we've talked about policies and procedures, monitoring and auditing policies, monitoring, reporting. So a lot of variety. But I certainly think when you're talking policies and procedures, monitoring and auditing, those are 2 fantastic areas where we can really collaborate and work together. And one of the examples we picked, because it's something that's near and dear to our heart here at Provider Trust, but I think can fall right into monitoring and auditing as well as policies and procedures, is just that role of oversight of your people, right? When you think about how do we make sure that the people that are caring for our patients are the right people, HR starts by doing background checks and looking at all the references and the interviews and all the components that they do to make sure that those people are coming into our organization are the right folks. And then there's this transition somewhere perhaps between HR and compliance that says, and how do we make sure that that continues on a routine basis, that nothing changes about this person? So I think one of the important things is the role of compliance over here on the left, right, is teaching and educating and making sure everyone understands why this is so important. We had an opportunity maybe 2 weeks ago to actually go on site with one of our clients. I cannot tell you the joy it brought me to be able to finally be back on site with a client. But what was so great about it is I'm the chief compliance officer. My background is compliance, grew up 30 years, right, in a healthcare organization. So feel like I'm comfortable in all the spaces, but I was brought in to educate all of their HR folks on compliance and exclusions and licenses and what it means and why it's important, because they're the ones that are doing the investigations, and they really didn't understand what it means to have someone that's excluded. And so just that joint relationship where HR says, gosh, we're doing all these investigations. I have people in all of my locations who are doing investigations because I'm asking them to, but I haven't even given them the why it's important. So I think that collaboration is so exciting for me. And I think just a really great opportunity and an example of where HR and compliance can come together. And then when we have a situation, right, what's the role of HR? Really figuring out what that story is, right? What's this person's job? When were they hired? Where did we get this information? Were there any concerns, right? Just helping build that story. And then together, the 2 teams can make decisions about what's next. What was our process? Do we have opportunities for improvement? All of that comes together. And if you want to kind of roll that up with a bow and go back to what's most important to you all this year and talking about reporting, auditing, and monitoring and policy, right? You can use this example and say, what would my procedure be? What's my policy around monitoring my team and then reporting if there's an issue? How am I going to audit that or monitor that? How am I going to make sure that I have an audit in place, that everyone's being monitored on a routine basis? Every license is being verified, making sure that it has been renewed timely. So I think that you could just take this one tiny, it's not even tiny, but this one really important component and use it as a template or a guide to looking at your policies, procedures, and auditing and monitoring relationships together. So this is a slide that I slightly modified, very slightly modified, that I used in our orientation at Provider Trust with all of our new employees, because I think it's so important for them to understand that the work that we're doing at Provider Trust has direct impact on our clients each and every day, not just from a hey, we found a bad actor in your organization, but hey, there's real life impact to people when we have these findings. So I call it code red. You can use obviously any term that's meaningful for you, but for my team, that's what I use when I talk about it. So when we find an exclusion match, when you find an exclusion match in your organization, stuff happens immediately, right? Somebody's probably getting suspended. If somebody's getting suspended, what does that mean? That means that if they were on the floor or they were on your schedule, now all of a sudden you have a hole in your schedule. You might not have enough staff on the floor. Someone else has to get brought in, right? All of a sudden, not one person is impacted, but an entire unit or the whole hospital or whatever, however you organize your people, all of that group is impacted right off the bat. Then what happens? Then we have to start an investigation. We were just talking about that, right? There's an HR component to that investigation. There's a compliance component to that investigation. What does this person do? How long have they worked? Did they take care of any of our patients? What was the reason that they were excluded? Does it relate to patient abuse? Was it theft? What was it, such that I now need to do an investigation of, has that happened while they were here in our organization? Oftentimes we bring in external resources to help us determine the potential self-reporting obligations. Outside counsel may have to help us come up with some of those costs and considerations when we're making that. Certainly, whether you're using outside counsel or not, you and your team are trying to decide whether you have to self-report to the OIG. Is it a state Medicaid exclusion, or are there state Medicaid dollars that are impacted? Thinking about what potential fines or sanctions the organization may have. That doesn't even count for all the internal reporting that you have to do to your compliance committee, potentially to the board, just to your leadership team. All of those things happen very, very quickly. And then the last piece that you hopefully can take a deep breath, step back for a moment and say, okay, I've dealt with this initial situation, but gosh, where did my process break down? What happened? Where do I have opportunities for improvement? Is it something that HR and compliance weren't communicating on? We need to do a better job of, or maybe it wasn't clearly delineated whose accountability it was, and we just kind of fell through the cracks. So I just think this is an easy example, one that is a clear impact to all of us, and a great place where, again, HR and compliance really, really have to collaborate.
Thanks, Donna. As we move to close here today, here's the takeaway and what does solidifying the partnership and actionable next steps look like for a template that you can take. Here's the prescriptive nature of what we're advocating for. This is the next 3 slides are a template that you can apply to any of those 7 effective elements. 7 elements of an effective compliance program, right? We give you an example of monitoring, but with each of those, this evaluating your current process is the first step. And so for us, when we think evaluating current process, here are actual, here's tactical questions that relate to monitoring, but it's an evaluation template that you can apply to any of these. So as it relates to monitoring, how often do you screen your providers? Just understanding the nuts and bolts of the process. How accurate is your provider credential information? Where's it coming from and what's feeding it? How are credential concerns communicated across HR and compliance teams? How quickly does this occur? Are there regular cross-functional meetings about employee monitoring best practices, right? So here's a good template to take for the monitoring piece. But for each of those 7 elements, it starts with evaluating the current process around it and where are the joint accountabilities and shared accountability between HR and compliance. The plan for collaboration, again, template for each, define roles and responsibilities for HR and compliance, identify overlap and duplicity, identify areas of risk that should be monitored, define a cadence for communication. I'm going to highlight Jennifer, who actually shared in the chat just a couple of minutes ago their communication cadence and process, and what does that look like for hotline calls, and it's impactful. And so Jennifer's talking about the cadence that she is on with her HR and compliance counterparts, But it should be that easy to just grab and say, yep, here's our process. We've talked about it. We're mutually aligned. Here's how we get on the same page on an ongoing basis. And so the last piece here then is just collaboration, initial and ongoing. We talk a lot about monitoring, initial and ongoing. And when we were talking about that, we really quickly saw the parallels in just how do we collaborate in a similar way that we actually look at data. And from an initial perspective, the steps and the takeaways from today are ensuring the right people are caring for your patients, provide a consistent compliance messaging upon hire, disseminate, as Donna mentioned earlier, the code of conduct in the employee handbook and on what cadence, validate licensing and certification requirements, ensure compliance with all state and federal documentation requirements. And then on an ongoing, things to do outside of that initial collaboration is to share joint values. And I would actually recommend you go so far as to talk about what they are between HR and compliance as well. Don't just say, yep, I think we share the same values. Actually have a conversation with that with your HR and compliance counterparts as well. It's powerful what comes up when you do. We do this often at Provider Trust. Inevitably, something comes up that you as a strategic leader didn't see coming. So would really advocate you spend some time and kind of poke at that a little bit. Monitor staffing and turnover metrics, stay current with regulatory changes and required messaging, review disciplinary actions, monitor licensed professionals, monitor for exclusions, collaborate on hotline investigations, just like Jennifer outlined in the chat, and HR related audits, and ensure HIPAA awareness as well. And so as we wrap up today, hopefully this has been a good refresher. We've got one more slide here and then we'll close off. Today's been a 30-minute webinar. You're getting the slides, recording, all the good stuff via email. We have over 700 pieces of content on providertrust.com that are all free as well. So if you are looking for a checklist on how to connect HR and compliance, or you are looking for an ebook on the exclusion authorities, as an example, if you're just looking for good insight on primary sources or best practices, it's all here and it's all free. There's a really good chance we have a content piece for it. We average at Provider Trust about a new piece of content produced every day, and it's all free. So I would just really encourage you, if you're looking for a place to start, there's a good chance it may actually exist right here in a resource library. And the last piece today is we wanted to just extend. We're all continuing to deal with the COVID-19 and the pandemic, and certainly our thoughts are with each of you as y'all continue to lead just such critical work to keep us all safe. Just on behalf of everybody at Provider Trust, thank you for doing the work that y'all do. We appreciate you deeply. If we can be a resource or help with any of that along the way, please let us know. You're certainly our heroes. I know there's been some talk about, do we overuse that word? And in my opinion, I think the answer is no. And so thank you all. And we are here to help along the way. That's it, friends. Appreciate your time today. You will get all the stuff shortly from our marketing team. Just be on the lookout in your email inbox.
Thanks, everyone. See you next month.